We have at 2 p.m. there'll be a press briefing by the Permanent Mission of Bolivia on Bolivia's proposal to address the global crisis from the perspective of indigenous peoples. 3 p.m. a briefing sponsored by the Permanent Mission of Canada to the United Nations on the Chilcotin Nation's call for action to address the toxic drug crisis in Canada. Couple of briefing operationals for tomorrow at 8 a.m. tomorrow. Yes, 8 a.m. The new 3-star Syrian flag will be raised next to the flag of the other 192 member states and the 2 permanent observers. If you have any questions for visual coverage, please check with our colleagues in MALU. They will facilitate that. And just to stay on Syria, Geir Pedersen will be here to brief the council tomorrow, and he will be speaking to you at the stakeout afterwards. Also tomorrow at 11 o'clock, there'll be a hybrid press briefing by Ambassador Lauber, Jürg Lauber, the president of the Human Rights Council. And our noon briefing guest will be Ulrike Richardson, the humanitarian coordinator for Haiti, who also serves as the deputy resident coordinator for Haiti. She'll brief us virtually on Haiti. Thank you. This evening, as a reminder, the Secretary General will be traveling to Rome, where on Saturday he will attend the funeral of Pope Francis at St. Peter's Basilica. This afternoon, the Secretary General will sign the Book of Condolences at the Permanent Observer Mission of the Holy See. And on Tuesday, there will be the UN flag will fly at half-mast to honor the passing of the late pontiff. And on those days, no national flags fly. Our Deputy Secretary General Amina Mohammed continues her visit to Washington, D.C. for the World Bank IMF spring meetings. This morning, she took part in a women-led breakfast with over 50 female leaders, which was hosted by the World Bank managing directors. Amina Mohammed highlighted women's labor and economic participation as one of the most powerful forces driving inclusive and sustainable development. She also called for women's leadership to be placed at the center of decision-making. Later, she participated in the G20 ministers and central bank governors meeting, where she underscored the importance of advancing reforms to the international financial architecture to make it more inclusive and responsive. This afternoon, she will deliver remarks at the 111th meeting of the World Bank IMF Development Committee and continue her engagement with senior government officials and key stakeholders. She'll be on her way back later today. Turning to the situation in Gaza, the Office for the Coordination of Humanitarian Affairs warns that the total blockage of aid and any other supplies now nearing nearly 2 months has led to the depletion of essential such as fresh food and tents, and the near exhaustion of other critical supplies for Palestinian civilians. Children are going hungry, patients are going untreated, people are dying. It is time to lift the restrictions immediately. The complete restrictions, of course, of aid and other essential supplies going in has obviously driven up the prices of essentials. According to the latest analysis, food prices have increased between 29% to as much as 1,400% above pre-ceasefire levels, with many essential items like dairy, eggs, fruit, and meat no longer available on the market. On average, in April, prices rose 50% over March levels. Shortages of cash, reduced purchasing power have pushed many people deeper into hunger. Yesterday, the acting humanitarian coordinator for the OPT, Susanna Kalach, together with her team from OCHA, visited Deir el-Bala and Khan Yunis. In Khan Yunis, they visited the main desalination plant for southern Gaza, which has been operating in only 15% capacity due to electricity cuts imposed by Israel. As a result, the people's access to clean water is extremely limited. They also visited 2 makeshift displacement sites to assess the living conditions of families staying in these crowded locations. In Deir el-Bala, they visited a community kitchen run by the Atfaluna Society for Deaf Children, which provides food, skills training, and social support for youth and women, including people with disabilities. Meanwhile, emergency shelter partners report severe shortages of tents, of tarpaulin, and essential materials. Warehouses are almost depleted, which is limiting shelter assistance to just a fraction of what is actually needed for people to survive. For its part, the UN Population Fund and the agency's partners continue to address gender-based violence and deliver supplies and services critical for sexual and reproductive health across Gaza. This week, 10 reproductive health kits, enough to reach more than 6,900 people, were distributed to 6 health partners in the Gaza Strip. Key hospitals were also provided with emergency supplies. More than 900 women and girls received dignity kits, menstrual hygiene supplies, and other items. And 245 sessions on gender-based violence were held, with 200 new cases files opened. Moving north to our colleagues who serve along the Blue Line, the force commander of U.N.I.F.I.L, Lieutenant General Haroldo Lazzaro, met with President Joseph Aoun of Lebanon today. They discussed the situation in the mission's area of operation. General Lazzaro also briefed the president on how U.N.I.F.I.L is realigning its efforts to deal with current and evolving challenges and support the parties in implementing Security Council Resolution 1701. The mission, together with the Lebanese Armed Forces, continue efforts to locate and address unauthorized weapons and ammunition caches as well as tunnels. In the past week, U.N.I.F.I.L discovered weapons and ammunition caches on 3 occasions and referred those to the Lebanese army as they are mandated to do. Meanwhile, U.N.I.F.I.L is undertaking an assessment of 272 markers that dot almost half of the 120 kilometers of the Blue Line. Some of these markers have been damaged or destroyed during the recent hostilities. While the exercise continues, the mission has found so far that 188 of the markers are intact and has prioritized 10 others for immediate refurbishment. A quick update on Yemen, where I can tell you our special envoy for Yemen, Hans Grunberg, was in Oman today, where he met with senior Omani officials, members of Ansar Allah leadership, and representative of the diplomatic community. Those talks took place in Muscat, the capital. Their discussion centered on the necessity to stabilize the situation in Yemen, to allow all Yemenis to live in dignity and prosperity, and to address the legitimate concerns of all stakeholders, including the region and the international community. Discussions also focused on our continuous calls to Ansar Allah for the immediate and unconditional release of detained UN staff, as well as staff from NGOs and civil society and diplomatic personnel, which continue to be held. And in the Democratic Republic of the Congo, our peacekeeping colleagues tell us they welcome the signing of the joint declaration issued on 23 April. That would be yesterday, and that was issued in Doha by representatives of the government of the government of the Democratic Republic of the Congo and the Alliance Fleuve Congo Movement March 23, known as AFC/M23. The signing marked a significant step towards de-escalating the conflict in the eastern part of the country. The agreement, facilitated by Qatar, reflects our shared commitment to establishing a truce as a foundation for an effective ceasefire. The mission commends the renewed resolve demonstrated by both parties to prioritize dialogue and peaceful conflict resolution, not only within the DRC, but across the wider region. We are also encouraged by the declaration's emphasis on inclusive engagement, calling on all sectors of society, including citizens, religious leaders, and the media, to promote messages of unity and of hope. We urge all parties to seize this opportunity to advance the peace process, placing the protection and well-being of civilians at the center of all efforts. And just to flag a dramatic situation, and that is of Haitians in the Dominican Republic. Our colleagues at the International Organization for Migration tell us that there's been an increase in the number of vulnerable individuals among those deported from the Dominican Republic to Haiti, particularly women, including pregnant and lactating women, children, and even newborns. On the 22nd of April alone, IOM staff at the Belladere border crossing in Haiti received 416 deportees, including 11 pregnant women and 16 women who are still breastfeeding. While IOM teams are not present during the deportation process itself, their efforts focus on the needs of deportees upon arrival, many of whom arrive in precarious and highly vulnerable conditions, often without any resources. IOM provides immediate humanitarian assistance, including food, water, hygiene kits, and dignity items, as well as first aid and medical referrals and psychosocial support. Special attention is given to maternal health, and temporary accommodations are arranged for those women who are breastfeeding when necessary. And within Haiti, just to highlight the dire humanitarian situation, as our colleagues on the ground warn that rising violence and recent funding cuts are undermining essential services and worsening the humanitarian situation, particularly in the center department. Escalating violence by armed groups has triggered mass displacement, with more than 51,000 people, over half of them children, fleeing recent attacks. Many are now stranded at makeshift sites or seeking safety in neighboring departments. The University Hospital of Mirebalais, a major referral hospital with about 300 beds, operated by the Zamni, has suspended operations following a wave of insecurity in the area. Armed attacks, a mass prison break, and the destruction of public infrastructure forced the hospital to gradually shut down. Before its closure, it served nearly 850 patients each day, including through maternal care and advanced cancer treatment. Two other hospitals in the area, Sainte-Thérèse in Ash and Albert Schweitzer Hospital in Artibonite, are now coming under increased strain and face critical shortages, including oxygen, emergency medical kits. Since the closure of the University Hospital in Mirebalais, they have treated more than 200 patients from gunshot wounds, strokes, suspected cholera, and malnutrition. Sainte-Thérèse alone has received more than 3,500 internally displaced people, tripling its outpatient caseload. UNICEF and our humanitarian partners are working to relieve pressure on health systems in the center department. In coordination with the government and Caritas, mobile clinics are being deployed to reach 30,000 people in host communities and displacement camps. 4 months into the year, our humanitarian response plan for Haiti, which requires $908 million to support 3.9 million people in Haiti, is only 6% funded, with only $57 million in the bank so far. For the health response, partners require $43.5 million, but less than $7 million has been received to date. We are committed to keep providing aid as security and funding allows, and I've already told you about Ulrike Richardson being here tomorrow. Moving to Ukraine and the worrying developments there, our humanitarian resident coordinator there, Matthias Schmale, strongly condemned last night's large-scale attack by the armed forces of the Russian Federation on residential areas in Kyiv and surrounding regions, which killed and injured civilians, including women and children, which is what local authorities are telling us. Mr. Schmale called it yet another appalling violation of international humanitarian law and underscored that civilians must never be a target. In Kyiv, attacks were reported more than a dozen locations across the city, and some 20 residential buildings were damaged and several destroyed, authorities are telling us. Our OCHA colleagues say that at least 9 regions of Ukraine, including Kharkiv, Dnipro, Donetsk, Zhytomyr, and Kherson, were also hit by strikes overnight, with local authorities reporting that nearly 175 civilians were killed and dozens more injured. We and our humanitarian partners rapidly mobilized to provide emergency aid and other services. Almost done. A couple more notes. One from Myanmar, and which in response to the devastating earthquakes that struck the country almost a month ago, humanitarian agencies have been working to save lives in a new environment characterized by our emergency relief coordinator, Tom Fletcher, as a humanitarian reset. This is including moving the response closer to those we serve and partnering with local organizations to reach those in need, including the delivery of medical care, shelter, clean water, sanitation, support, and food. As part of this reset, we're stepping up efforts to support local responders who've long been the backbone of the humanitarian response in Myanmar. The UN's close partnership with them includes providing flexible support through the Myanmar Humanitarian Fund. In the first allocation from this pooled fund in 2025, we channeled 80% of the $20 million provided to 66 local partners, including $4.7 million for the earthquake response. As part of our efforts to reach those most in need, we've secured access to some hard-to-reach areas in Saigang for the first time. We now have a coordination mechanisms in Saigang and are planning the UN presence there to be scaled up and scaling up also the response, as this was one of the areas hardest hit by the earthquake. We've also been able to reach areas that had previously been difficult to access in Mandalay. Programming, we hope to have the acting resident coordinator for Myanmar to brief you next week on the 1-month anniversary. Before we turn to international days, today is the start of World Immunization Week. It aims to promote the use of vaccines to protect people of all ages against disease. As you well know, increasing outbreaks of highly infectious disease are a concern for the whole world. And as we saw in recent years during COVID, how vaccines saves lives. The World Health Organization, UNICEF, and Gavi, the Vaccine Alliance, however, warn that immunization efforts are under growing threat as misinformation as well as funding cuts jeopardize progress, thus leaving millions of young people and adults at risk. UN agencies and their partners are calling on people and governments around the world to strengthen support for immunization. Today is an international day which should be a day every day, and that is the International Day of Multilateralism and Diplomacy for Peace. The Pact for the Future is a great example as it reaffirms our commitment to peace and the protection of human rights. Today is also the International Girls in ICT Day. On this day and every day, indeed, we encourage girls and young women to pursue their education and careers mainly in the fields such as science and technology. Joe, you are not a poster child for Girls in ICT Day. But since you were the first one to raise your hand, I will answer your question.
Thank you.
No offense.
No offense taken.
Excellent.
I just want to seek a bit of clarification on the Secretary General's position regarding the continued U.S. bombing in Yemen. As long as the Houthis continue to fire rockets and missiles in the Red Sea, Israel, and not heed the Secretary General's request to stop such aggression, is the Secretary General still calling for the United States to cease all of its bombing campaigns, or just to be more precise and limit as much as possible civilian casualties?
I think, Joe, we have been, in fact, and I've talked about Yemen a couple of times last week and earlier, we've been very clear that we want to see an utmost restraint. We want to see a cessation of all military activities in and around Yemen. We've been expressing our deep concern at the civilian deaths that we've seen as a recent U.S. bombings. We've also expressed our concern about the continued Houthi attacks on Israel, the sending of missiles towards civilian areas in Israel, as well as the continued attacks on the Red Sea. And we've been very clear in calling on the Houthis to fully respect Security Council Resolution 2768, which calls for a halt against attacks on merchant and commercial vessels in the Red Sea.
Yeah, but I have to bring this down to reality on the ground. Those are noble ideals, but the fact is the Houthis are not listening. They're not ceasing their firing of rockets and missiles. So would the Secretary General still expect the United States, for its part, to stop its bombing as long as the Houthis are still committing aggression?
We have been engaged for a number of years now, and especially through the very active work of Mr. Grunberg in diplomacy. There have been great gains in bringing peace to parts of Yemen. These continuing kinetic activities risk bringing Yemen even further backwards. I think this is just the latest chapter in conflict that is from which the Yemeni people have suffered. It has been going on for a long time. We need to see an end to all of the things we've called for and a resumption of diplomatic activity. Gabriel, then Stéphane.
Thank you, Steph. As you'll recall or remember, on March 19th, there was an incident in Gaza where a UN staff member was killed and at least 5 others were severely injured. Israel for weeks now has denied any involvement in that, saying that there was absolutely no IDF military fire in the area at the time. However, today, the Israeli military admitted that it was their troops that mistakenly, in their words, shelled the UN guest house that killed the UN employee. What is the Secretary General's response to that?
The Israeli authorities have communicated to us the conclusions of their investigation, and we welcome it as more. This incident has and the investigation. There's been more cooperation and transparency on their side that we've had in these types of incidents since the beginning of this conflict. However, what is clear to us is that we need to have accountability. We need to have accountability not just for this incident, but we need to have accountability and transparency for all of the other times we've seen UN colleagues killed in Gaza or UN infrastructure attacked. And again, we call on all parties to fully comply with international humanitarian law. And that includes for us the protection, obviously, of civilians, but also the protection of UN and humanitarian staff.
Israel apparently says they're going to conclude their probe in the coming days and will release their findings to UN representatives. If they in fact do that and release some sort of findings to the Secretary General, will he release them publicly?
We will be we have been very transparent on our side, and I think I would refer you to what the Secretary General said on March 24th, right? What we said for him, where we were very clear that it was an Israeli shell that hit a UN guest house, whose location was clearly known to the IDF. It is not for us to release information from other parties. We know where we stand, but as I said, what we need to see is accountability. Madame, and then sorry.
Hi, this is Munira from CNN. The President of the Dominican Republic announced a series of measures to curb illegal immigration, particularly targeting Haitians. One of these measures, which took effect earlier this week, involves deploying immigration officials at hospitals to identify and deport undocumented Haitians after they've received medical care. Does the UN have any comment on this policy?
Well, I mean, I think I just highlighted our concern and what the IOM is seeing. I can tell you that our team in the Dominican Republic is looking at the new measures that were announced by the government, but we are very much worried about their potential impact on health, as one of the measures includes, as you said, documents checks in hospital. This may have a very quick and negative impact on those seeking health care who may not want to seek health care because they don't feel hospitals are safe places. And this includes women who are who may be about to give birth. Every country has the right and has the responsibility to police its borders, to protect its own borders, to protect its sovereignty, and determine their own policy in terms of migration. At the same time, the dignity of migrants needs to be respected. The dignity of other human beings needs to be respected, and the human rights need to be respected. And that goes for every country in the world. Stéphane, then Michel, then Evelyn.
Thank you, Stéphane. Did the Secretary General have any contact with the government of India and Pakistan in the last 24 hours? Because it looks like the situation is escalating.
He has not had any direct contact, but I can tell he's obviously following the situation very closely and with very great concern. We were very clear in our condemnation of the terror attack that occurred in Jammu and Kashmir on the 22nd, 2 days ago, which killed a large number of civilians. But we very much appeal to both the governments of Pakistan and the government of India to exercise maximum restraint and to ensure that the situation and the developments we've seen do not deteriorate any further. Any issues between Pakistan and India, we believe can be and should be resolved peacefully through meaningful mutual engagement. Michelle, then Evelyn.
On that note, does the Secretary General have anything to say about India suspending the water treaty with Pakistan?
I mean, I think this would go under the rubric of us appealing for maximum restraint and not taking any actions that would deteriorate the situation further or increase tensions in a tense area. Evelyn.
Thank you, Steph. On the Ukraine, where the United Nations and its partners have delivered much needed aid, is the UN in any way involved or observing some of the political discussions? Because this keeps going around in the same circle.
Which political discussions?
The ones the United States thinks it's having, or Zelensky may be involved.
I mean, we're obviously following the situation very closely, and as I've mentioned a number of times before, our colleague Rebecca Greenspan has been available and has answered questions from different actors involved in these issues.
Is she?
But we have no UN presence in any of these talks.
And what is Mrs. Greenspan doing?
As I said, she's been, I mean, as you know, she's been involved in issues relating to freedom of navigation on the Black Sea and the Memorandum of
Right.
Understanding.
Thank you.
Yes, please.
Thank you, Stéphane. I may be asking you to repeat yourself here. On Myanmar, so you've talked about this humanitarian reset. Which areas are, in Myanmar are the UN focusing on now?
I think it's the ones I just mentioned. But one of us should be paying attention to what I say. So if I'm not, you should be. I can tell you, it was Saipang and I will find it for you. It was Saigang and areas around Mandalay.
Thanks.
No problem. All right. I wanted to wish you a good weekend, but it's a little early for that. Tomorrow? What's tomorrow? Today's Friday. No, today's Thursday. No. All right. See you guys later. No.